Let's move to our open agenda. Consider and discuss resolution and order renewing and extending declaration of local disaster issued for public health emergency for a period of 30 days to expire on February 8th, 2021 at 11:59. The CARES Act has been suspended, and we're coming to the end. We need to renew.
Extended.
Extended, I mean, what did I say?
Suspended.
Suspended? I meant extended, thank you. Thanks for the correction. We have a motion to do this.
Second.
All in favor? Opposed? Motion carries. All right. Emergency management.
Good morning, Judge and Commissioners.
Morning.
At this time, I'm going to introduce Darren and Chris Perkins from the office to assist us with item A.
All right.
Morning, Judge, Commissioners.
Good morning. Chris, thanks for coming.
Yes, sir.
Consider, discuss, and take appropriate action regarding the prioritization and distribution of COVID-19 vaccinations. So about a week and a half ago, my office, realizing the distribution that the state was undertaking through dishes, we began working on some con-ops and plans to do vaccinations across Montgomery County and get our citizens taken care of. Once we initiated that task, I assigned it to our senior planner, Chris Perkins. Chris, as you may have seen here recently, some emails introducing him came to us from the city of Houston. He was the Deputy Director of Emergency Management for the city of Houston. We were fortunate enough to bring him to Montgomery County. He was attached with our senior planner. As one of his tasks has been working up a series of con-ops to begin mass vaccination to our citizens in Montgomery County. So I'm going to turn it over to Chris, let him kind of talk to you a little bit about what he's been working on, and then if you have any questions, feel free to shoot them our way.
Great. In this presentation, we will also be addressing how the vaccine actually comes from the state to the entities and how the county is actually bypassed, because there's a lot of concern. The reason why I wanted this on the agenda is there's so many people calling our offices asking for us to get them the vaccine or wanting to know what the county's doing. So if you could explain the county's involvement in the process, that'd be very helpful.
Yeah, that's the topic.
All right.
Very good. Yeah.
All right, Chris.
Chris, go ahead. If you would, speak into the mic so we can all hear you.
Yes, sir. Thank you. Okay, as Darren alluded to, we've been working on a plan to conduct mass vaccination operations here in Montgomery County for the past few days. We have been tracking the development of the vaccine through Operation Warp Speed as it's moved down and now been approved for emergency use authorization. We've got two different vaccines, Pfizer and Moderna, that have been approved under that emergency use authorization and have been shipped to the states. The state of Texas controls the allocation of the vaccines down to particular providers. We have very little to no input from the county level on how those allocations are made from the state vaccine advisory panel down to the individual providers that receive the vaccine. To date, Montgomery County providers have received, we believe, in the order of around 26,000 vaccines, doses, individual doses, 26,000 doses, for a population count of, well over 600,000 people. Of that, we believe as of this morning, out of those a little more than 26,000 doses that have arrived in the county, less than 2,000 of those are actually left on the shelves, and maybe less by now, because the data that I have was pulled early this morning, and it was based on yesterday's vaccine counts. So what we're seeing is that the providers that have those vaccines are getting them out of the door in a reasonable amount of time, and that 93% or more of the vaccine that has actually arrived in the county has actually already been used and given to those in categories 1A and 1B, which are hospital workers, essential personnel, and those over the age of 65 or with comorbidities that make them more susceptible to the virus. So what we've been doing is looking at the weekly allocations that come down from the state and looking at the pattern of how they're doing those allocations. The first thing I'll tell you is that the state of Texas has been focusing thus far on two different subsets. Hospital providers, getting those out to those healthcare workers. So we've been seeing large doses go into our hospital systems for use within those hospital systems as they see fit. And then from there also to our nursing homes, our senior care facilities, assisted living facilities, and those types of demographics. What we have also seen the last couple of weeks is a large number of the doses that are coming into the state being allocated over to the large pharmacy chains like CVS and Walgreens in order to be able to do that outreach into those nursing homes and assisted living facilities. Now that week 5 has ended and we're going into week 6, there's no longer a federal mandate to do those pushes into the vulnerable populations in nursing homes and senior care facilities. So we expect that in coming weekly allocations, that the state is going to continue moving into the mass vaccination model that the governor announced yesterday. And so if you looked at last week's week 5 allocations, you're seeing out of the large bulk of vaccines that came into the state, they only went to 18 different counties, 18 out of 254. And those are the large metropolitan areas. For instance, Harris County got more than 16,000 doses sent in to their public health agencies with the intent that they'll act as sort of a regional hub. And at this point, that's the state's plan at the moment for the week 5 allocations. Moving forward with the week 6 allocations, we don't know what those will be as of yet because the vaccine committee is in the process of meeting early this week and taking a look at what vaccine stock is still left on the shelves around the state and determining where the next best place to put that. So what we've done is we have developed a mass vaccination sort of concept of the operations of how we would execute it here in Montgomery County when we begin to get large doses or large stockpiles of vaccines that we can push out. We've developed a plan that has a location out on the west side of the county, one location out on the east side of the county, and then 3 locations along the I-45 corridor north and south that will give us the capability to do hundreds of vaccines per day at each location. Now, we're totally dependent upon those vaccine allocations coming down to providers within the county. At the current, go ahead, Judge.
Question, we had a problem when we talked yesterday that the state was way off on the numbers. We weren't getting the right numbers. You've made calls, you've done the research, now you've found that. Now we know that we can handle this coming up. Now they had tremendous errors in their process so that we had to kind of find out and correct. The question is for us to move forward with this, even though we're ready, is there enough communication going on between us and the state that says, look, you guys were at this, you were so far off, this is where you really are, and we can handle the upcoming stuff. In other words, are we going to be able to communicate to them in such a way that they don't look at us and think that these numbers from yesterday are the numbers, but in fact the numbers you've recently come up with less than 2,000 vaccines available with the 26,000 actually received? You know what I'm saying? And is that going to be communicated so they'll do something about it? They're going to leave us hanging?
It already has, Judge. We've addressed that with the Texas Division of Emergency Management and with the Department of State Health Services. They are aware of the discrepancies in the systems that are maintained by the Department of State Health Services and the Texas Division of Emergency Management, and their IT folks are actually working on trying to resolve those discrepancies this morning. I can't give you any information on what the cause of that discrepancy is. However, we do believe that the numbers that we pulled this morning are about as accurate as can be expected at this point.
Does the state have available the vaccines to be able to give us? We become a mega site or a mega county where we start distributing this stuff. Do they have what we need, or do you know?
Well, we didn't, the state, obviously, in all the states, don't have enough vaccines being shipped to them from the federal government. There's just simply not that large of a supply out there. So as soon as the state is aware that, one, we have a mass vaccination plan in place and are ready to go with 5 sites, I've communicated that to them, both to the Department of State Health Services representatives and to the TDM representatives. And we're prepared to provide them with any information or any information that they ask for with respect to the operation of those sites.
Great, thank you.
Another point to what Commissioner Knight was talking about earlier was there's partners in this besides the county. The county is not an official provider of the vaccine. So between public health and Lone Star Family Health, pharmacies and hospitals, we've partnered with them to assist us with distributing on the mass vaccine level and it's dependent on them receiving their supplies as well. So the partners that we've worked with have also notified the state that they are eligible or capable of taking in more and they're able to give out more in a weekly.
Who are the hospitals that we're involved with?
So far, we've had communications with St. Luke's. St. Luke's has stepped up and said we're ready to go right now. They've indicated to the state directly that they are ready to be a mass vaccination provider. We're also in communications with Methodist and Herman as well as TCH. So we're talking to all of these hospitals and saying, hey, if you'll check that box on your survey and say, yes, I will do the mass vaccinations, we have the con-ops ready to go. We worked through the logistics. The county was ahead of everyone else when we started preparing. If you remember, we came to you several months ago and said, I need some money to buy the essential supplies necessary, the freezer space, the refrigerators, the supplies. We have all that in place. We've communicated that both to the state and to our local partners, and everybody's on board. Now we just need the vaccinations to start rolling in. And as Chris indicated, we have had those communications almost daily with the state. And I think what you're going to see now is what we're hoping as far as the state's plan, that carve out that's mandated by the feds to go to the long-term health care facilities, it's not going to happen anymore. So it's going to become more vaccine available for distribution throughout the state.
Okay.
So as this vaccine is more available to the public, first of all, when it comes from the state, do we have any say over which vaccine we get?
No.
So let me ask you a question, because
So each of the providers have a survey they take each week and talks about their storage capacity and the number of people they can distribute this to during that weekly period, and they update that regularly. Most of the providers in the county are not eligible or not capable of storing Pfizer, which requires super ultra cold storage. The county, through our partnership with some of these folks, we have storage available and have made it available to them. So they're checking both boxes. They can accept both vaccines.
the reason I ask is the research I've done and the communications I've had with some physicians within the county, there seems to be concern over the fact that once you're vaccinated with the Pfizer vaccine or the Moderna vaccine, you really need to be revaccinated with the same vaccine. And if we are not doing something to make sure that people get that, because there are no studies that have been done, on does it work to have a Pfizer vaccine followed by a Moderna vaccine. So
And it's
we
not
need to be
recommended.
doing something to make sure that people get the right vaccinations when they need it.
Well, at this point, the state has indicated to every provider on the list that you should be getting out your vaccines as quickly as you get them. Do not hold any back and wait for round 2, which is the second shot for those first groups that got them. You will get reallocation to cover second shots, and it should be of the same quantity and number of the same vaccine you received the first time, or each week to make sure the second shot is given within the same manufacturer of the vaccine. So that's what the state's pushed down on the providers.
Okay, so just to recap this, so that we have no control over the distribution of the vaccines coming from the state.
That's
And
correct.
that's
Montgomery County
important
is
for
not
the
a
public to
healthcare provider,
understand.
yeah.
How many more, do we know how many more first responders and that type, are they all done, or they still got some of those?
They're not at 100% at this point, and Darren can jump in here. He's keeping closer tabs on that. We've been scrambling to find providers that can give out vaccines to our first responders. And some days we may not know until late in the afternoon that they have X number of doses left that they can push out, and we'll scramble and get as many people in there as we can. At some point, some of these providers were allowing us to send them a list, and they were emailing these first responders and getting them signed up. From my understanding, Darren, correct me if I'm wrong, if you're a first responder and you've wanted a vaccine up to this point, you've had access to get one, or access to get on a list to get one at this point. It's not that every first responder has raised their hand and said they want one. So that's why the state moved very quickly to phase 1Bs, because phase 1A was moving slow. There was not a whole lot of demand at that level.
So you said that there's been roughly 26,000 vaccines distributed to Montgomery County.
26,375.
How many constituents do we have that fall into categories 1A and 1B?
A little over 30,000.
Okay, so we're just a little bit short of
No,
doing it.
excuse me, 1A, 30,000.
1A alone.
Yeah, 1B is going to probably be over 100,000.
So we have 30,000 first responders,
Yeah. Medical first responders, nursing care, nurse worker, all the.
so we haven't even received enough to take care of.
Nowhere near it. Yeah.
That's important.
And are the requests, we get more and more requests now, the longer we go through this?
The demand and request from the general public is very high. We anticipate when we do when we are able to open these mass vaccine sites, that there's going to be a wait, there's going to be appointments list. I mean, the demand for it's going to be great. And the providers all are aware of it, and they're asking the state for multiple thousands of doses at a time right now.
Of the 26,000 that were given to us, you got about 1,800 to 1,900 left right now, right?
That's
So the
correct.
demand is there.
That's correct. So that shows two things. Number one, with that percentage, that shows that Montgomery County can handle the vaccinations as they come in.
Yeah.
So we are meeting our requirements from the state. And two, it does show that the desire from our citizens, our healthcare workers, our first responders to be vaccinated. So I think that data does show that, and I think that's a good indication where Montgomery County's at. We're just waiting on the state.
Is there anything that y'all can see that we might be able to do to step up the process of getting these quicker, or more of them, or what do we need to be
We
doing?
wish we could, but those decisions are made by that allocation at the vaccine panel, and so that's all being done behind closed doors, and those decisions are made by that group, and then they're pushed out. There's about a 2 or 3 day window where people can see what they're anticipated to get. They can make an appeal or in a case and say, hey, this is, and the feds have to approve that list, and then they start shipping them out on usually the following Monday, Tuesday.
But we'll know more on Monday, is that right?
We should
We'll
know more
know
later by
Wednesday,
Friday.
Wednesday afternoon, Thursday, we should know what our next week allocations look like.
Okay, good. Excellent. All right. Is there any more discussion on that? All right, then let's move on to our second topic, and this concern discuss take appropriate action regarding changing the funding source for our warehouse lease with OEM. Jason?
So last month in December, the court approved extending the lease that we have in the warehouse. The court took action on that and approved it with use of contingency funds. At the time, that was because the CARES Act was expected to expire. Now that it's been extended, this item would reallocate the use of contingency. So we would use CARES funds to cover that lease and put back about $150,000 in contingency.
All in favor? Opposed? Motion carries.
Item C, consider and discuss take appropriate action authorizing OEM to make necessary purchases related to vaccine distribution and distribution sites and not to exceed $100,000. These 5 locations across the county that we've identified and have worked out the
Can
logistics
you name
of.
these 5 locations?
I do not want to name them at this time because I don't want people harassing them without vaccines on site. So as soon as we have the vaccines and that model opens, we'll name them.
Yeah, plus we're not
In
opening
advance.
them all at the same time.
Correct, we'll name them in advance. I can say we have 3 along the I-45 corridor, north and south, 1 West County, 1 in East County, identified, ready to go. They're just gonna need a lot of logistical support, traffic control, tents in order to ensure there's shade for the healthcare workers that will be administering. Some
The
of
one
them,
in South County is the one we discussed?
no, sir, I'll get with you on that one too.
But when we are ready,
That is an option we can still throw in there. We just gotta find a provider willing to use it.
Can we move this into executive session to have a talk about this, Amy, or Petey? Because I want to know where these are going to be. I think it's important for us to at least have an idea of what we're.
well, here's, may I make a suggestion, Commissioner?
Because before I vote on it, I want to know.
I'm
Okay,
willing to do that. It is a security issue that we could discuss if the county attorneys are fine with it.
we can do that here, and if you guys are okay with it. That has to be noticed, right? Yeah, okay.
Well,
Here's the,
it's not a security issue. And if it's not a security issue, I'd like to know where these are going to be.
But it's not where they're going to be, I think it's right what he's saying now. I'm sorry. I think what he's saying now is that it's preliminary and that absent additional information, he's not ready to make that information public.
here's the deal. If we come up, we know we have the sites, and as we have final agreements and everything in place, and we have a certain order, as we do that, we can do a press release, let people know.
Yeah,
So
I
when
don't
it
think that's
comes
the
out.
commissioner's issue.
I think the commissioner's concerned that he wants the information prior to voting on this item as to where these
Right.
sites may be, and that he feels like that is necessary information to have prior to voting.
Correct.
Okay, then we can, okay, we could do that. But concerning what you're concerned about, Jason, how do we deal with that relationship with the commissioner? What are your thoughts?
Well, the biggest concern is the moment these providers were made public, because it is public information, who's receiving the vaccine, they start getting inundated with calls, and that slows the process of distributing the vaccine down because they're transferring these calls to the vaccine team on site that are doing this. And instead of putting shots in arms, they're taking phone calls from the public about availability, and it's inundating. And the moment we announce where these sites are, they're going to be inundated with these types of calls when it could be another week before the state allocates any to us in order to even open these sites. So I didn't want to put that cart before the horse, so to speak, on that. And I have no problem telling you guys what's going on. It's just opening that up to the general public at this point would cause a lot of folks to start going to these sites every day and looking for a vaccine that's just not there yet. And I'm trying to avoid that.
Right.
The request at hand for the 100,000 is each of these sites are going to need cones, traffic control devices, tents, a number of things in order to adequately logistically support them, and it's going to cost money.
That's what you're looking, so like Darren had asked me if I'd be willing to provide traffic control devices and cones from the precinct.
And you
to do
could,
this. So
yes.
absolutely, yes,
Yes.
so I don't need you to go out and buy those.
No, but I would
if
need
we
tents
have
for,
them.
I would need tents for that site, and these are large tents, large enough for cars to be able to drive through them. So-
Why? I thought you have to get out of your car to get the vaccine.
No, these mass vaccine centers are all drive-throughs.
Something, well, I thought we had this conversation and if you get the Pfizer vaccine, you have to be observed for 10 to 15 minutes.
All folks have to be
after.
observed. The model and the distribution model to be mass vaccine is drive-through. You still can be observed while in your car as you proceed through the process. You'll have paramedics on site to observe you for that anaphylaxis that we're concerned with. The certain provider that we've talked about, Commissioner, is not willing to do a drive-through model, and as a result, that provider is going to be unable to hit that 1,000 person per day number that the state's looking for in order to distribute a vaccine to that provider. So the other providers we've brought into the table to be a resource to the county are able to do the drive-through model. Their physicians are kept comfortable with that signing off on that model. And as a result of that, we'll be able to hit that 1,000 vaccine per day number that the state's looking for to be able to be a mass vaccine hub. So that's the,
I think what he's asking is $100,000 for supplies regardless of where the site location is. Those might increase or decrease based on where those sites ultimately are. You may need more tents at certain locations. Other ones may not require as many if they're going inside. You may need more staffing to monitor people inside. So these may change
Also,
with that.
it's not more money, it's an up to, not exceed.
Yes, well,
Not mine.
he may be bringing additional costs or expenses back, but at this point, in order to start the process, he's asking for $100,000.
Does that include staffing, the
no,
100,000?
the 100,000 will not include staffing. The item that was approved in earlier, the Haggerty Amendment contract number 5, that is using already approved funds for the additional staffing that we would need on the administrative
Give us
side.
an example of something that you would need to purchase that you haven't already purchased.
I would need at least tents larger than this room at 5 locations, potentially simultaneously, that would be up for multiple weeks at a time. And event tents and stuff are not cheap. And this number is probably an underestimate. It's just enough to get us going where we feel comfortable for at least the next couple weeks until another court can happen. We at least have some authorized funds where we can purchase and lease the items we need for vaccine distribution across the county.
I don't have
obviously
a
want us to
problem
be
with this.
prepared.
I don't have a problem the way this is right now. I would ask that if you check with each precinct or each commissioner before you go buy a bunch of barricades, a bunch of,
Absolutely,
and see what we
by
got.
and large, that'll be 100% reaching out to these commissioners to use what we already have in-house. And a number of those types of items we already have because we've done testing sites like this. However, the tents, we didn't purchase tents, they're hundreds of thousands of dollars a piece. We leased them at the time,
I
so.
move on C.
Second.
All in favor? Any more discussion? Motion approved.
And
Thank you very
item
much.
D is for staffing. In order to provide traffic control and on-site security at these locations, I'm asking for.
This is on
I
E now, Your
yes,
Honor?
sir. Yes, sir. Asking for authorization for $50,000 for our law enforcement departments within the county, so we can use overtime for that.
Any discussion? All in favor? Opposed? Motion carries. Thank you.
Thanks.
Commissioner, I'll meet with you after.
Appreciate it very much, guys. Appreciate your hard work on this.
Yes, sir.